We are live, people. That's right. Come on in. Welcome, welcome, welcome. Come on into the Dead Zone with Scully and Average Joe. Let's go ahead and refresh here and see who we got coming in here today. Come on in. Welcome, welcome, welcome. Yep, giving me a thumbs up. I'm going to go ahead and share ourselves out here for a second. Let's go ahead and I shall do that as we speak. That is done. Done with one. Very, very, very easy now. There we go. Here comes number two. Come on in. Welcome, welcome, welcome. Come on in. Thank you so much. I'm going to go ahead shouting us out. All right. I just kind of Facebooked us there. Here we go. On Facebook, shout it out. Beautiful. A little bit of a lag, probably like a 5 or 6 second lag. Wait for some people to come in. We'll see what happens. I don't want to sit here and talk to myself when there's actually no one in the chat room. That'd be kind of foolish. Looks like I did have another thumbs up. Someone came in, gave me a thumbs up, and jumped back out. So I thank you for that. We'll see what happens. I got me, myself, and I in here right now. Today we're actually going to talk a little bit more about the disc. I finished up yesterday with the basic anatomy. Hi, Miss Galaxy. Hello, sir. How are you doing? I'm doing just well, Miss Galaxy. Thank you for coming. Welcome, welcome, welcome. Come on in. You are the first in the live stream today, so congratulations. Woo! See that, Scully? Miss Galaxy's the first to come in today, so thank you for that. Let's see if we'll get some more people in here. I just started this live maybe just a few minutes ago. I am doing well, Miss Galaxy. And we're going to kind of go a little bit more into the different kinds of surgeries that you can have. Yes, I am first. Yes, you are. And so we're going to talk a little bit today about the different kinds of surgeries that physical therapists and you might actually receive on the spine because you're having some disc issues. And so they want to resolve these disc issues, and they couldn't do it by what we call conservative methods, whether that's through pain management or through physical therapy or chiropractic treatment or a doctor of osteopath treatment. So maybe we'll talk a little bit about that also. Well, I'm going to wait until we get at least a few people in here. Miss Galaxy was first. She kind of jumped out. We shall see if she returns. Currently almost 3:30 on the East Coast. No, that's not right. Heart rate 35, I don't think so. I'm still waiting, Miss Galaxy. See if I can get a few people in here. Oh, be the difference. Hey, 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 Average Joe. Miss Ali Bango official, showing my support, dear boss. Thumbs up, done. Thank you so much, both of you. I tell you, this Miss Be the Difference clothing, she does all kinds of stuff. Uh, from exercising, I've seen that one live stream. I've seen her where she designs and sells all kinds of clothing. She designs and sells socks and hoodies and t-shirts and sweaters. And so if Miss Ernie Hatmaker's in the house, Beautiful Expression Rose is in the house. Beautiful, come on in. Welcome, welcome, welcome to Average Joe and Scully's live stream. If you guys have any questions, we're going to go ahead and start out with what I finished up yesterday, which is starting out with some surgical types of techniques that they do for disc problems. And so that's kind of like an overarching or over umbrella concept for today's live stream, as well as hopefully getting some good connections, getting some good viewership, and hopefully we'll all have hopefully a good time. Hopefully me, I can answer some questions if you guys have any. I welcome any and all questions, and hopefully I can either answer some of it or at least steer you in the right direction that you need to go to hopefully get your question answered. I at least can do that for you. And we'll go ahead and we'll get started here. Be the Difference clothing. I got Miss Galaxy saying, come on, Miss Be the Difference. Miss Galaxy's looking at you already. Hopefully get a good connection there. Be the Difference clothing. I think she is monetized. And so if you could at least try and watch her 30 or 45 second commercial. I'm sure she would love to have that. I think I'm almost 100% she's monetized. Ernie Hatmaker's in the house. I got Nico VDH says hello. Hello, Joe. Hello, Nico. How you doing? Welcome, welcome, welcome. Come on in. Hopefully get some connections. We're going to start talking about the different surgeries that they can do when you have a disc problem. Ali Bago official gives me a bunch of hearts and loves. Well, thank you so much. Hopefully you can get some good connections in here. Hopefully if you have any questions, or maybe I can answer them as I start my discussion here. But hopefully we got 5 watching right now. Hopefully we'll get some more. That would be awesome. I do my live streams on Wednesdays, Thursdays, and Fridays. Tomorrow's live streams is probably going to be a little bit earlier. Probably about 1-ish, 2-ish, somewhere around there. I'll be doing my live stream tomorrow. And we'll probably be kicking off some exercises that you can do for the disc problem. We'll probably end up towards that realm at the end of this treatment, or at the end of this live stream or LS. And so let's go ahead and let's go. Okay. So to kind of just give everybody a recap here, just for a second. We talked about the anatomy yesterday a little bit, all the basics. This is the red thing is the disc. You have your spine, the bone above and below. That makes up, that makes up that you don't tear your computer apart when, it's amazing. That wire, it connects over everything. It absolutely baffles by me how that wire gets connected. But anyways, so if we took out just 2 of these little vertebrae back here, 2 of these little bones, okay, and we kind of blew them up, we'd have this. So I kind of give you an idea where we're coming from. So you have a disc between each of the bones. The disc helps cushion everything. You have your spinal cord in the back. You have your nerves that come off of your spinal cord on each side. If you can see it there, it's kind of a light yellow, but you can see the better from the side when you can have a nice separation between the red and the white, the yellow right there. All right, so that's the nerves coming out from this spinal column or spinal nerve area, and then the cord, and then coming out from the cord, those peripheral nerves that I'm describing you here, and they make up basically your arms and your legs. All right, hopefully give me a shout out. That would be wonderful. If you could, I shouted myself out on Twitter and Facebook, as well as obviously on YouTube. I would much appreciate it, and so wouldn't Scully. So let's just say that you've tried physical therapy and didn't work. They've tried injections, which let's talk about that in just a few seconds. You've tried chiropractic. You've tried pain management. Come on in. Welcome, welcome, welcome. ECTB's in the house. ECTB's in the house. Alternative tongues. What? Alternative tongues. You made it today. Nice, nice. Come on in. We're talking about surgery for disc problems of the spine. So that's our thing today. Oh my, I got Miss Cubsden. Welcome, 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 Miss Cubsden. Come on in. Oh man, and we got the main one, Cubs Den main channel. We ain't got Cubs Den live stream, Cubs Den. What was the third one? Live stream, Cubs Den live stream. There was what was the third one? Oh shoot, I forgot it already. Oh, I got thumbs up, boss. El Bingo official here. This is Karesh. Miss Ernie Hatmaker shouted me out. Thank you so much. Much love to you. I got 11 watching. Algeria Croshaw. Woo, I got some Spanish or Portuguese. All right, come on in. Been back to work since Monday, so I can't keep up with your schedule. I'm sorry, Alternative Tongues. I appreciate you coming in when you can. Much love to you. I saw your last live stream, and you talked about where you were going back to work, and it was going to be harder to even do your content. So I always say this, definitely take your time doing it. Oh, come on in. I don't know why that keeps hiding Nico. Alternative Tongue, hello. There we go. All right. I don't know why it keeps hiding your stuff there, Nico. I'm going to make you moderator if that continues to do that for some reason. Miss Galaxy, Be the Difference Clothing. Oh, she got a rose. You got a rose. Look at that. I'll be. Ha. Nice. All right. If you have any questions on the disc or the surgeries that we're going to talk about today, go ahead and shout them out. I'm going to go ahead and bop back and forth so I don't miss your guys' comments. So let's talk about, you've tried conservative physical therapy, that didn't work. You tried chiropractic, that didn't work. Thumbs up to you, boss. Thank you so much. Thank you so much. Much love to you. Much love. Nicole's in the house. Come on in, Nicole. Thank you for coming, my dear. Thank you very much for coming in, as well as everybody else. I hope you can shout me out. Much love to you all for that. I much appreciate that. I haven't been playing your 2 hours yet for coming to my live stream. Oh, that's all right. You're busy, Alternative Tongues. Anytime anybody can go ahead and play a live stream, or if they want me to play their live stream, you know, I much appreciate it. I know we're all trying to get, you know, some of us are already monetized, like Miss Cubs Den, and I'm sure Be the Differences. And I appreciate when they can just come and hopefully I'll answer some of their questions if they have any. Hi, everybody says. All right, so first thing, so they tried conservative physical therapy. That didn't help with the disc problem or leg pain or sciatica. We tried chiropractic manipulations and stuff, massage type, kind of combine those two together. That didn't work. Now we're going to go into pain management. And pain management, first of all, is going to try some different kinds of injections. And what they do, I thought Scully was missing for a second. No, Scully's right there. Scully's in the background. He's just in the background. He's there. And so, excuse me. What they will do, it's called fluoroscopy. Essentially do an epidural block or an epidural injection or spinal blocks, however you want to describe them. They're all about the same thing. Oh, there he is. GoDonnie.com is in the house. GoDonnie's here. GoDonnie's here. Come on and clean up that place, man. Just kidding. Yeah, I'm in the dead zone. I got all the skeletons around me. There's no insulation. There's no heat. There's no air conditioning. I called it initially the doghouse. I call it the dead zone now. There's nothing up here but Scully, some bones, and crazy me. So I coined it the dead zone. It kind of plays on words a couple different ways. So that's me. Hopefully you guys think it's funny. I think it's at least tongue-in-cheek, that's for sure. Okay, so we tried all that stuff and didn't work. Now we're talking about pain management. And essentially, without taking pills, steroids, or muscle relaxers, or narcotics, they're going to try and do injections. There's two different techniques that they'll do. Oh, ECB, you got Cubs Den says, back to ya. Look at that. You got Cubs Den. Look at that. Live streamer herself with blue jeans and Cubs Live and the other Cubs channel that escapes me for some reason at this time. And so they'll do, it's two kind of medications they'll do. They're going to normally do lidocaine. They'll do 1% lidocaine usually. And that's there to numb the area and try and reduce the pain. And then they'll do the steroid. They'll do either Depakote, they might do prednisone, they might do dexamethasone. All these steroidal derivatives, essentially what they're trying to do is shrink the nerve, reduce the inflammatory process, and hopefully get the radicular nerve symptoms to resolve or abate or go away. ECTB saying thank you over there. Cubs Den, thumbs up with a big smile. Look at that. We got Miss Galaxy. Nico with much love. Alternative at Nico. Shout out to you. So Miss Nico. I'm terrible with names. Please forgive me for my ignorance. I apologize. I got Miss Galaxy and Mr. Tongues, Alternative Tongues coming out to you. So hopefully we can get some shout outs. Same to you. There we go. Same to you, Alternative Tongues. There we go. Beautiful. Match made in heaven. Look at that. Boom, boom, boom. Beautiful. Beautiful, beautiful, beautiful. Love to see it. Love to see it. You guys can say you guys got your connection on Average Joe and Scully. See you soon at Miss Galaxy. Okay. So let's go ahead, and what they'll do is they'll normally do an injection from the side, because if you have a disc bulge, let's say that disc is pushing out on the nerve right there and it's recessing a little bit, they'll try and inject into that site right there. So that's the first kind of injection they'll do. They'll bathe that nerve right in there with steroid and that lidocaine to try and reduce that pain and get your symptoms to go away. Now the technique they use is essentially, it's a live x-ray known as fluoroscopy. They'll have two different screens and they're going to show a side view and a back view, or a posterior and a lateral view they'll look at, so they can take that needle. And this needle is hollow initially. So that first needle that they're putting in towards this site is going to be a hollow needle. And what they do is they take that drug, they put that hollow needle in there, then they put another needle in through that hollow area. They'll inject an area. That better be coffee. Yes, it is. Yes, it is. Joe runs on Dunkin'. This is my Dunkin' Donut coffee I had this morning when I started work. So this is my first and only cup today. Can you imagine if this was like my set? As hyper as I am right now, because I like doing this and I'm excited to teach you guys and hopefully get connections and stuff like that. But can you imagine if I had a lot of coffee in me? I'd be bouncing. I'm already bouncing off the walls. It'd be even worse. Jeepers. They'd have to put me on Halidol or Thorazine or something like that. Oh, Mr. Blue Jeans. Mr. Blue Jeans. I didn't realize it was you that made that. Mr. Blue Jeans. Hi, sir. Mr. Blue Jeans is in the house. Much love. Hi, everyone. Mr. Blue Jeans is here. Hopefully, you guys get connected. That's the other side. Mrs. Cubs Den's better half, I would say. Never met the person, but they are very, very nice as far as I'm concerned. And they've been very active with me. and all of them have Mrs. Cubs Den, and all of them, and all you guys have actually. But I'm just, shouting out to Mr. Blue Jeans for a second. All right, we got your music. We got. All right, I'm gonna have to make you moderator because for some reason it wants to. It wants to put your stuff. There you go, Nico. It wants to. It keeps wanting to pop you for some reason. Oh, you know what I should do? They told me. Who was I watching? I was watching four Change or whatever his channel's called. There we go. If you guys didn't see it, I think it's 4 Change Life, or I keep forgetting his name. He's a real nice guy. He just did one here, where he talked about where you have live chat and the arrow down, where you can click either. When you click down, it says top chat or live chat, all messages. I don't know. Mine got reset for some reason, and I think a lot of people's did. So if you want to see all the chat, make sure you click under live chat. You click under not top chat because that's going to make some things not visible. You want to make live chat. That way everybody can see they can see your stuff and you can see their stuff. So if you're having problems where it looks like you're not seeing your comments on your actual live chat, make sure you go up there and click that down arrow that says live chat, and it pulls down 2 options. Because if you don't, I don't know what YouTube, all I can say, I'm going to jump off on my bandwagon for a second. Hey YouTube, go back to work. I want you humans to go back to work because YouTube is messing up in the backstream. Take the robots out, put the humans back on the helm, and get this thing working like it's supposed to. Please, I implore you, YouTube, please, oh please. Please work again, please. Ah! I know I should have been an actor, but I wound up here. All right, so let's go ahead. Who says you can't act? I mean, literally, right? They tell you where to stand. They tell you what to say. They tell you how to dress. They tell you how to move. I mean, anybody can be an actor as far as I can. If you can read, you can act. You know? Yeah, it's been happening almost everyone. YouTube is having issues. YouTube has been having issues since they let the robots go to the helm and everybody went home. You know, it's been crazy. One thing after the other since like February. Since like January, February, it's been one thing after the other with YouTube. And it's been because they've taken a lot of human interaction or, meddling, or however you want to describe it as they've taken them out and they've added all these robots. It's been an absolute disaster as far as, I mean, not complete disaster, but when there's something wrong, they seem to lag the time to fix the problem. Okay, so let's get back on that. So we'll talk about the fluoroscopy, where I said they'll have 2 live x-rays. You know how an x-ray looks like? You'll see the bones and stuff. That's what they'll see. They'll have that needle, that hollow needle, go down into the side, and they'll see that needle going down in. They'll look on the 2 cameras. You'll be lying on your stomach, and then they'll go ahead and take the other needle through the hollow needle and start to inject the lidocaine, that 1% numbing agent, and then put the steroid in. Excuse me, and then you're all done. Literally, start to finish, 15 minutes, maybe 15 minutes. Alternative tongues, be at the difference clothing. I left you with love note. What are the side effects of steroids? There's lots of side effects of steroids. Some people are allergic to steroids. And then you have a lot of problems because it's going to affect a lot of things. It could affect your heart rate. It could affect your breathing. You could have, all of a sudden you start to panic and anxiety kicks in, and that just compounds the issue. So the side effects are hunger, restlessness, I mean, you could literally, you know, you get excessive sweating. I mean, headaches, nausea, all kinds of crazy stuff. You know, you might get none of them, you might get all of them. I know when I've been on oral steroids in the past for back problems or something like that, I usually get very anxious, kind of like that, can't sleep, I'm hungry, always hungry. You know, it seems like your appetite can't be suppressed at all. Adds attention to detail. Adds attention to details in the house. He is coming in. He is probably taking a break from building his house. If you watch his last video, he just got done laying down the base of the septic system, and he was just showing you at the very end the hot water and cold water lines that are going to go down. This guy's building his house from scratch. If you want to see how to build a house from scratch, go watch Ed's detail. And I talked to Ernie, his wonderful wife. Oh, I didn't talk to her. I mean, I YouTube live stream, whatever you want to call it. I guess it's a form of communication. I'll at least say that much. She talked about the length and the width of the house. It's gonna be huge. This is a huge house. It's like 2,200 square feet. The house is gonna be, and he's building it. So, as well as he does all kinds of other stuff. But that's kind of like, I mean, that's when you're building a house and you're doing it and you're doing all of it or doing some of it. I don't know. She says she's doing all of it. So I mean, I'm like amazing, because I know years ago with my wife and I, when we had our modular home built, oh man, that was a modular home. You know, the foundation, the septic, and all that stuff we had to do. And that was that was all hired out. I mean, this guy's doing it himself. So if you want to see some of probably, I'm sure he's going to show the negatives as well as the positives. But Ed's attention to detail. Now, that's not all his channel. I mean, he does make models and all that other, builds models and paints and all that other stuff. So he does a barrage of things on his channel. So, and he did a nice memorial to all the vets and stuff like that. Was very, very touching and nice. So if you want to see that one, because he is a military vet, and like I always say to all my patients and people that I see, I say, thank you for your service. Because, the reality is I get to do this. And, I only can speak as being a United States citizen. Obviously, this goes out to the whole world. And I have other people that are not, from the United States. And so all I have is my point of view for the United States. But, when it comes to the military, and, I have to put my hats down to them, So, anyways. I call it talking. Yeah. What? Call it talking. I just, I wanted to make sure, like, hey, Ed's like, what's he talking to my wife on the phone now? What's going on here, people? So I at least wanted to make it quite obvious. All right, I got 9 in the house. Absolute McGregor. Absolute McGregor's in the house. Hi, host. Got the old hands up. All right, so I digress. Let's talk about the injections again. And so they'll do the side one. They'll do a cycle usually of 3. They'll do one, then they'll do one at 6 or 8 weeks, and then they'll do another one within, that 12 week or 3-month period of time. So they'll try to do 3 in essentially 12 weeks. The reason why you can't do more than that is because steroids are essentially, if you look at it this way, it's the needle itself is laser guided, but the medication's not. That medication's gonna bathe that nerve, kind of reduce the inflammation, shrink everything, hopefully reduce the inflammation around that nerve and the disc so that your pain goes away. The problem with that is this, is you can't keep injecting steroids into an area over and over again in a short period of time, because you have ligaments and tendons and muscles that are around this area that can get weakened and become destabilized from steroids. Steroids over time will chew up anything. The inflammatory process is normally a normal healing process. It's when the darn thing won't stop or shut off is when it becomes a problem. And so the reality is yes, you want to do steroids after the conservative therapy didn't work, chiropractic didn't work, massage didn't work, all these different techniques or what we call modalities did not work, or interventions, however you want to describe it, didn't work. And so your last ditch effort, before you go under the knife, so to speak, is pain management steroids, or a combination of steroids and physical therapy, because I see that a lot. We'll do the injection, and then we'll wait about 24 to 48 hours after the injection, and then we'll come in and try some more different types of techniques. Because the reality is this: if you got that nerve, you got that disc right there blown out on that nerve, a herniation, and at this mark, the last thing we can't get that thing to reduce it all, go back in. We got to figure out some way to reduce that inflammation. I have Ed at Nicole. Same weather here, but the scattering seems to land right over the top of us each day for a couple hours. We are having scattered thunderstorms. Yeah, we're having them here too. The whole week. Corticosteroids are always the first thing they want to do. Well, they shouldn't be. So she's talking about corticosteroids. There's different kinds of steroids. She's describing one particular segment of steroids. But yeah, that's the reality. Sometimes if all of a sudden you see a primary care doctor and you have ridiculous symptoms down your arm or in your leg. I have to go back to work. Just done with my lunch. Thank you so much for coming by, Mr. Tongues, and hopefully I'll come over and see you next time. Thank you so much for coming. Much appreciate that you could come and see me during your lunch. Hopefully I gave you a little bit of entertainment. Unfortunately, lunch breaks go by like that. It's amazing that work can't go by that fast. Oh well. I guess if it did, they wouldn't pay us. Stay safe, Miss Ernie Hatmaker says at Nicole. Okay, and so, boom, we got that out. We want to get it reduced, whether it's through steroids or whether it's... So she talked about corticosteroids. That technically shouldn't be the first thing they do, but a lot of times primary care doctors will go ahead and oh yeah, we got nerve pain. Let's give you a 5-day pack of steroids and see if we can reduce that pain. So, I mean, it's appropriate, but... and hopefully they should know you. I mean, they know your medical history. They've seen you before. They're treating you for who knows what, diabetes, high blood pressure, who knows what. And so, yeah, they know your history, and hopefully they can knock it out of you. Hopefully they will then also send you to physical therapy, or the reality is to hopefully figure out why it happened in the first place, and hopefully get it not to come back again. Or if it does, it doesn't come back as bad the next time. So that's another good reason why, even if they get the steroids and the muscle relaxers or anti-inflammatories that they give you, it makes your pain go away and stuff. It's always good to make sure that you then follow up for some therapy. That way, it doesn't have to be a lot. It could be just 2 or 3 weeks or whatever, just to make sure that your symptoms don't come back again, or make sure that they don't happen, or if they do happen, that they're not as bad as as they were that last time. Blue Jeans, why are you holding Scully backbone? He's just staring at you. Please give it back. Nicole says, Britt. Lots of laughs at Blue Jeans Network. Yeah. Miss. Why are you holding Scully's backbone? Yeah. And he's just staring at you. Please give it back. It's funny. I do. If you look at this, there you go. There you go. Where there's one spine, there's another. And where there's another spine, there's another. So Scully can have it. That's even worse. You took his neck. Yeah, well, you know, sometimes he gets pretty mouthy. Have you guys noticed with any of the videos? That last video, that last force snapping hip syndrome video that I showed on Sunday with my good friend Ty at the clinic, he got sassy, didn't he? He got kind of sassy in that video. Well, let me go ahead and refresh here because this YouTube loves to freeze up on you. Okay, so I got a little spiny here so that you can have a good one there, Scully. One skull, Doc, was that Scully said right? Oh, yeah, once, that's right. You like that one, huh? One skull, one therapist. He can get his own skull. Come on, if that isn't funny, I don't know what is. You know how long it took me to figure that one out? It took me a while. I mean, these jokes, I'm not a comedian. These jokes just don't come out of thin air. They take a while to think of. What's poppin', my guy? Lex Logger 12, come on in. Welcome. Come on in, Lex Logger 12. Welcome. Come on in and get some connections. That's what it's all about. Hopefully learn a little bit. We're talking about injections. We talked about first time in the chat. Yes, it is. Thank you so much for coming. We got some new people. I guarantee you, since this is your first time in here, I'm sure you got a bunch of people that you have not been connected to. Welcome, everyone. Please remember, that's right, thumbs up and share the stream if you can. Thank you so much. I appreciate you. I have 17 thumbs up. Today, I have 0 thumbs down. Yesterday, I had 2 thumbs down. At least they thought about it and gave me a thumbs down, you know, but that's right. I had 17 thumbs up so far, 5 in the house. I've had a few people drift away. That's okay. It happens. Okay, so we talked about the side view of the injection. Now let's flip around. You're on your stomach. Now they're going to do right in the back. They're going to do those facet injections right in that back side area. Or what we call the posterior lateral side here. Thumbs up or down are just haters. Yeah, well, I mean, everybody's got a belly button and everybody's got a right to an opinion. But they don't have a right to facts. See, there's a difference between opinions and facts. You can put thumbs down. That's all right. I mean, I'd like you to have a thumbs up because I don't know if it messes up my algorithm or not. I'm hoping it doesn't, but if I have more thumbs up than thumbs down, I'm probably doing something right. At least they gave you watch hours. Exactly. That was my what do they say? The hook, line, and sinker, or the what do they say for a comedian when they say it's the comedians have a phrase for that. You know, the punchline. That's the punchline. That I got watch hours out of it, even with the thumbs down. That's true. Everyone has an ass too. But yeah, well, you hope so, anyways. Unless you have cancer or something like that, then you might chew it out of you. They just need to stop being one. Yeah, that's all right. Different strokes for different folks. So now we talked about this. So we're talking about that. So you're on your stomach, and they're kind of coming in from the back laterals. Let's see if I can move my hand so you can see it better. This shows kind of like the disc bulge. So you show the back lateral side where that nerve is, and they'll go ahead and inject that stuff in from that side, back lateral side versus just a side view, and to inject and see if they can get that nerve. Now, here is the catch. Here's the catch. A lot of times, when I get a patient that says, oh, I tried those injections. Those injections didn't help at all. One of probably a few things has gone on. Either A, they continued to do what activity was causing the problem in the first place, whether it was a lot of lifting, too much sitting, whatever it may be that caused the aggravation in the first place. They continued to do it. So when the steroid wore off, the inflammatory process started right up again because they never stopped what was causing the problem in the first place. That's usually uno moruno number one that's causing the thing to continue. Or the doctor isn't really hitting the particular nerve. And so that injection that's done, you get the first one done and say it didn't help. The physician, it's usually an anesthesiologist. Sometimes it's a physiatrist that will do these injections. It's usually one or the other that will do those injections. How are you, Joe? I am doing well. Casa Casa. Come on in, Casa Casa. Thank you, thank you, thank you. Welcome, welcome, welcome. Come on in. Let's get some connections. We are talking about right now spinal injections to reduce nerve pain coming from a disc. And so that's the big one. The other one is is that Jonah? Jean's channel. Come on in, girl. Welcome, welcome, welcome. Come on in. Jean's channel's in the house. Thank you so much. Come on in. Hopefully get some good. I heard steroids are good. Keep on good looking muscular. 2 different kinds of steroids. I heard, yeah. How are you today, host? I'm doing very well, Miss Jeans. Thank you for coming. Much appreciated. We're talking all about disc problems. We're talking about back and disc problems in the spine. So come on in, get some connections. Welcome, welcome, welcome. Give me a shout out if you're able to, if you're willing to. Much love. I would love that, as well as Scully would love that too if you could give us a shout out. So hopefully we can get some more people. Hopefully I can get some more watch hours. Bing, 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 bing. But there's a lot of other reasons. I am providing some education free of charge. So that's always a pro bono. So that's a good thing, right? Miss Cubs Den Galaxy. Oh, lots of hearts and loves and smiles. So let's keep rolling. And so let's talk about first. So there's 2 different kinds of steroids. There's anabolic steroids, which is annulled, all right? And the other one is catabolic steroids. So there's 2 different types of steroids. One breaks down inflammation in tissue. Okay, that's the catabolic steroids. And the anabolic steroids build up muscle area tissue artificially. They're providing a hormone to that muscle tissue, which isn't good for your endocrine system, all right? Because what happens is as you artificially inject steroids into the body, and you do not have a deficiency in steroid or hormone, which is a hormone in our body, and there's plenty of them, estrogen, progesterone, just to name a few. What happens is your body's going to reduce the amount of hormone that it naturally produces because it's artificially receiving steroid. And what happens when you stop artificially receiving the steroid? Your body sometimes doesn't start producing the correct amount of steroid again. Then you're dealing with a permanent problem. All right? You are playing with fire if you are not seeing a licensed medical doctor, usually hopefully an endocrine doctor that specializes in that stuff. Otherwise, you're going to have problems. My guess, and this is truly just a educated guess, there's a reason why Arnold Schwarzenegger needed to have multiple heart surgeries. It's because he probably did steroids. All right? Your heart is a muscle, and it will enlarge your heart over time, as well as enlarge everything else over time, and it can really screw you up. So yes, that is anabolic steroids. And the catabolic steroids is what we're talking about, that they put in the body to reduce inflammation. So those are the 2 main types. Well, there's two categories. And within those categories, there's different steroids.
which I've talked about a few of them. The catabolic type, anyways, dexamethasone, prednisone, just to name a few. We got 12 watching in the house right now. Thank you so much. Now let's talk about that other injection. So they're going to, thank you so much, Miss Galaxy. I try. Hopefully get some good connections and comments while we're at it too. That's always great. And some good viewership. And so we're talking about, they're going to two different kinds. Either the anesthesiologist or the physiatrist, they're going to do the injections either from the side or from the back. Now they'll do what's called a facet joint injection too, where they go right into that and target that facet joint. And so that could be one thing. Now that's without any complications. You go in there with no surgeries or stuff like that. Now let's talk about when you have a complication, like you have a fusion of the spine. And what the heck's a fusion of a spine? Let's talk about that right now. Cooking with Rayo, come on in. Cook with Rayo, ooh, that's new. Cubs Den at Blue Jeans Network, thanks for sharing this link. Thank you so much. Thank you so much, Miss Cubs Den and Blue Jeans. Oh, Cook, come on in. I'm talking about steroids, all right, for disc problems. Sorry, Scully. I got a better visual with my movable disc than I do with baby spine, so you're just going to have to take it. So we're talking about disc issues along that nerve. We're talking about different injections that are done. Hopefully you guys get some good connections here. Got a bunch of new people. I know Mr. Tongues is upset because I know a lot of you people are, and I'm thanking you all to come in. I do my lives Wednesdays, Thursdays, and Fridays. I drop my new videos on Sundays. That's all on my channel art on my main page. It tells what days I do those, which is what I just described to you. Tomorrow's live stream will probably be between 1 and 2 o'clock Eastern Standard Time. I'm doing it a little bit early tomorrow, so maybe I can catch some other people. Hopefully you can come. I will be talking further about disc problems and how to treat them at home. Today we're talking more about the surgeries and different types of injections and treatments and drugs that they can do to help reduce the disc issue in the first place after conservative physical therapy and chiropractic treatment didn't help. Absolute McGregor, come on in. Welcome, welcome. VA Scratch King. Wow, brother. Come on in. VA Scratch King. Come on in. Welcome, welcome, welcome. Thank you so much. Thank you, thank you, thank you. We are talking about disc problems. We're talking about different types of injections that they're going to do, okay, for this disc problem. Wow, come on in. VA Scratch Off. He comes in. Beautiful. I seen him a few weeks ago on another one's live stream, and I got connected and hitting the bell. Love his stuff. He does scratch off tickets. There's a whole kind of genre or niche of YouTube that just does scratch off tickets. And there's a bunch, and I got connected with VA over there, and so he's awesome, and I watch his stuff. No worries, I appreciate all that you do and definitely catch you when I can from work. Proud of you that you do. Oh, thank you so much. Much love to you, sir, too. Hopefully there's some people that you've never met here. Hopefully you can get some good connections. Leave some comments. Hopefully shout me out if you all can. Obviously a lot of you have because I got some new people in here. Much appreciated. Hopefully, some of you people I'm already connected to. If I'm not connected to you, hopefully you'll subscribe to me, leave a comment so that goes right to my email, and so I can go ahead and click right on to you, watch it, comment, subscribe. All these people here know I watch their stuff. I am loyal. I watch people from Japan. I watch people from South Korea, the Philippines, Italy, New York. I mean, I watch you guys' stuff. I do. I try and leave comments when I can. So I'm up late watching this stuff, so I try as much as I possibly can. I have 1,600 subscribers. It's a lot to do. That's all I got to say. on top of doing my job, on top of trying to do, be a parent and everything else. So, yeah, I don't watch a lot of TV anymore, I'll tell you that. So, yes, that's true. Is the real deal. He has Scully too, so that's 2 for 1. Yeah. 2 for 1 deal. I got Scully back here. At some point, I'm going to get him animatronic. I'm going to get him where he's talking, he's moving, he lights up. So, I mean, at some point, he's actually going to move and talk. So, it's going to be quite interesting. I'm not quite sure how mean I want him to be. I might turn him into Archie Bunker. I don't want Archie Bunker was a racist character on a TV show All in the Family in the 70s. So I got to be careful how mean I make that guy. I might make him more like Mr. Jefferson. I used to watch the Jeffersons a lot when I was a kid. And so he used to call everybody honky. So maybe I'll make him more like Mr. Jefferson. I don't know. We'll see. It would be funny. Either way, I hope to make it funny for everybody. Oh, Miss Galaxy, Blue Jeans channel, that's right. Coming over to you, Galaxy with the Jeans. All right, yes, you can even watch mine from Zimbabwe. That's right, Absolute McGregor, I do. I have literally watched your channel grow ever since I met you on Gore's live stream. That's right, it's where I met you. Gore McTar. That bum, he doesn't watch none of my stuff anymore. He's got a fat head. He always, I love him dearly. He's doing live streams a lot. And I think he got caught trying to do more work at home because I think he owns his own business or has ownership or something like that. So, yeah, I think he's got he might have 2,500 subscribers at this point. I don't know how much he's watching your guys' stuff. At some point, you can't. There's no way, as well as YouTube is desubscribing people left and right. And if you had, even at my small rank of 1,600 subscribers, if YouTube is knocking off my bell, I'm not seeing their stuff. And it's usually, 1,600 people. It takes me a good month or so to get back to everybody that I've seen. So it takes me a while to get through 1,600 people if they're not making a lot of views. I probably have had 25 people I know over the last week that I went back to the channel and they haven't done anything in 3 or 4 months. So, and that's true. I guess the statistic I looked on YouTube, that is between 3 and 6 months. A lot of channels die out between 3 and 6 months. And so I know for a fact out of 1,600 people, 25 of them that I know of right off the bat, they just stopped making stuff at 3, 4, 5, and 6 months. So they still have their channel. They just haven't downloaded anything in months. So I don't know how your guys' thoughts are, but that's kind of like my math. So anyways, let's keep going. Hopefully, guys, if you have any questions, go ahead and shout them out there. Yeah, I started my day with a right click, a new tab for everyone. That's commented on my videos and views them first. Yeah. The Miss Yo-Yo Show. That is new. Miss Yo-Yo Show. Come on in. I want you to subscribe to me. If you would, leave a comment. I will come and connect with you, and I will hit the bell. Anybody who comes to my live streams, I already hitting the bell. You already know I'm going to be watching your stuff. I'm already going to be leaving comments, so you can already mark that off the list. Even if I don't understand a lick of what you're saying, I'm still watching your stuff. I try and figure out through either pantomiming or through the music or your pictures or whatever. I'll try and figure out what you're talking about. So, anyways, yeah, they don't upload because of YouTube burnout. Yeah, you got to be careful. I started out probably the first 6 to 8 weeks. I was making 3 videos a week, dropping edited videos, and then I went down to 2, and then I started doing live streams. So I backed it up with some live streams, and now I do. But I have to give myself some credit. It takes me 2 to 3 days to make one of my videos. To edit it, to do the After Effects graphics on it, the whole thing in a nutshell, if you see my last video, you'll realize, yeah, it takes several days to make that kind of video. I can't make it in one day. It's not possible for me. Oh, Cubs Den, the Miss Yo-Yo Show. Thank you so much. Auntie. Oh, Auntie. Oh, okay. Sorry, I know also you don't understand my language. That's all right, Mrs. Blue Jeans. I understand a little bit of what you're saying. That don't you know, I'm coming to your channel. You're not, it's on me. It's the onus is on me to figure out what the heck's going on, all right? Don't you dare change your, I wouldn't expect you to change for, anybody. You do your channel the way you do it, and I'll try and muddle through and figure out what I can. Don't you worry about it, girl. All right, Miss Yo-Yo, at an engine corner, hello. Oh, I missed one. I missed a shout out. What's wrong with this thing? I missed a shout out. Thought I missed a yes, I did. There they are. Hey, Auntie Yo-Yo. Miss N.E. Jenny. It's N.E. Jenny's Corner. It's in Jenny's Corner. That's how it's described. In Jenny's Corner. There you go. Please, if you could, I want you to, if you would, subscribe to me. Leave a comment. That way I can come after the live stream, because that stuff will go right to my email, and I can go ahead and click on my email and hyperlink right into you guys, versus me having to wait until this thing uploads. So, much appreciated. Thank you for coming. Hopefully shout me out. I do my live streams on Wednesdays, Thursdays, and Fridays. I drop my shows on Sundays. My next 4 videos are going to be the next series. So I did a 4-video series on stamping hip syndrome that I just got done doing. My next 4-video series is on back and disc issues. We're going to start out with what is a disc problem, what's the anatomy of that disc problem. That's the first video. The second video is going to be treatment techniques that you can do in your own home to help reduce your disc pain. The third video is going to be the surgical techniques that's done to reduce your disc problems, whether it's a spinal fusion that we're going to go over right now, whether it's a laminectomy, which is we're going to go over right now, which is we're going to do discectomy, foraminectomy. I'm throwing out these terms, but I'm going to tell you exactly what they are in just a few minutes. So that's going to be that next video. That'll be the third one. And then the fourth and final video in my next series of 4 discs is going to be different techniques that the physical therapist is going to do with you, whether it's traction, whether it's McKenzie protocol, whether it's Williams flexion protocol. So I'm going to go over whether it's ultrasound taping techniques. So I'm going to go over that. That'll be our 4th video in our disc series for back symptoms. So stay tuned for all those. First one's coming to you on Sunday. Be mindful that I haven't even started it yet. This is going to be fun. As one YouTuber says, you must enjoy the process. If you don't enjoy the process, you're going to get what my brother said earlier. You're going to get burnout on YouTube if you don't enjoy the process. If you don't enjoy this stuff, you're going to get burned out. It's that simple. All right, I got in Jenny's Corner. Thank you so much for coming. Sissy, appreciate it. I appreciate it for you coming. Thank you so much. Hopefully I can give you some information either for yourself, for your loved ones, for your interest, or maybe you become a contestant on Jeopardy and maybe it'll be one of the questions. This is Jeopardy. I've talked too long. My voice can't do it right now. No. These are what's the correct words? Well, they're made out of plastic. They're not real ossified bone. Those are very expensive. These are exact replica of your spine. This specifically is an exact replica of about as good as I can buy on the internet. This thing was about, this spine right here is about $150. That's the cheapest you can buy. This is about 150 bucks for this particular one right here that you're seeing. So they're not cheap. The ones that you're talking about a real human anatomy, you're talking some big money. Hi, Mom. Hi, Mom. Thanks for coming. Ann Kenny is my mom. She is not a content creator, and I haven't been over to visit her. She lives in another state, but I will at some point. Hope when I go over to her, I'm going to figure out and show her a very easy way if she wants to go to other people's channels. I got to get her, she got at least to this point, which is awesome. She can connect and chat. So she's here as an observer, and as obviously the one who brought me onto this blue ball, third rock from the sun. So give her all the love you guys can. Anyways, let's continue. So those are the 4 series coming up, and hopefully all you new people will hopefully come and see some of that stuff. And I have 70, 80 videos in my playlist about shoulder problems, neck problems, hip problems, knee problems, ankle problems, foot problems, headaches. You know, I got all kinds of stuff in there, all categorized of different treatment techniques that you can do at home for those particular issues. So if you like good content that is appropriate, given to you by a professional with over 20 years experience with a doctorate degree, that's giving you free stuff, I invite you to head over there. I mean, it's crazy. Anyways, but liability point out there, this is not a substitute for going to see your medical doctor. All right? I'm not diagnosing you. How could I? I haven't put my hands on you. I don't know your medical history. I don't know what medications you're on. How could I diagnose you? So yes, that being said, this is not a substitute for that. As you can see on all my videos, there's a giant liability screen that pops up before I start gabbing too much, as any professional should do. If you're going to see a professional's videos, okay, and they don't have a liability clause in there, you leave immediately, because they probably don't know what they're talking about, or they're phony. They're not really a professional. I'm a licensed professional. At one point I was licensed in 3 states. I was licensed in Maryland. I was licensed in New York State and Pennsylvania. Then I was licensed in New York State, Pennsylvania, and North Carolina, in the state I'm in now. So yes, I'm also a licensed provider. Unlike Dr. Phil. Dr. Phil's not a licensed provider. He doesn't practice. Hi, in Jenny's Corner. Oh, okay, sir. Thank you, loves. Even it's a replica. It's too expensive. Yeah, it's expensive. What do you think? Yeah, all my stuff. This is a knee joint. This is an actual movable knee joint. All right, this stuff is not cheap. All right, but if you're gonna make a decent channel, all right, you want to educate the people. Hopefully, you know, like everything else, you know, I hope to do well. I always do this. My mother hopefully will attest to this, but she doesn't need to. Obviously, there's some biasness in this. I always put my best foot forward. If I'm gonna do something, I'm gonna go full throttle. That's how I am. That's how I always am. And I'm gonna go right till I hit the wall, and then I'm gonna climb over the wall or run through the wall. That's what The Rock does. That's what I do. That's the American way. Really, Dr. Phil isn't licensed. No, Dr. Phil is not a licensed provider anymore. You have to, with any licensed provider, and this goes for any license in any state, whether you're a medical doctor, a physical therapist, a psychiatrist, a psychologist, whoever, whatever you're practicing, all right, and you're a licensed provider, you have to provide so many practical hours of work or interaction throughout the whole year, or whatever your state is. Mine is every year or every 2 years when you renew your license. You have to have so many continuing education units, also known as CEUs, as well as you have to have so many hours of practice. If you are deficient in any of those two things, your license will be dropped and you'll have to reapply. So he's been a talk show host. At this, he is not a practicing provider. He doesn't need to be. He's a multi-millionaire thanks to Oprah Winfrey. I mean, literally, Oprah took him underneath her wings. This is 25, 30 years ago or whatever, and made him who he is today. You know, he was just a schmuck like me. It'd be no different than if I had, you know, some talk show host invites me on, and I all of a sudden start doing this kind of act, and everybody loves it, and all of a sudden I make my own show. 25 years later, you have your show. You can't, you know, that's he fell in. I mean, you want to talk about someone who literally had a scratch-off ticket, like VA scratch-off. Dr. Phil had a $1 trillion scratch-off ticket, and it said Oprah Winfrey underneath it. That's really what he got. You know, he got lucky. Excuse me. Some of it, I'm sure, was hard work, but there is a certain amount of luck to it. Oh, thank you, Mom. 110% with love. That's the truth. If you want to know how crazy it is, let me tell you just for a second. This will take maybe 3 to 5 minutes. So, when I first started, when I got out of college, so I finished up with I was a physical therapist assistant when I first got out of college from Penn State. I went back to school, still working full time, to get my undergraduate degree, my 4-year degree, my bachelor's degree, also known as in the States. Then I was still working full time. I then went back and took my prerequisite courses to get into PT school, and I was doing that at night times, all right, as well as working full time. Then I went to PT school Friday, Saturday, and Sundays for 3.5 years as a clinical doctorate program, working full time and doing full-time schooling. Normally done Monday through Friday. The schooling's usually done in traditional. I condensed our Mercy College program is condensed 2.5 days, so it takes 5 days of information and condenses it into 2.5 days, and it does that for 3.5 years. So yes, it took 110%. Yeah, 110%. Then add another 100% on there. Not everybody can do a condensed weekend doctorate degree program, all right, that's normally spread out normally in a 5-day period of time. So yes, 110%. This is icing on the cake doing this on the side. This is nothing compared to what I've gone through. This is a walk in the park. So for me to burn out to do YouTube versus what I had to do in the past, please, this is a joke compared to that. So yes, just remember, when you guys feel like you're kind of burnt a little bit, just think about Joe, Average Joe PT and Scully, right? And Joe had to condense 5 days of a doctorate degree program into 2.5 days, and he did it for 3.5 years. Not a fall and spring semester, no. It's a trimester school. It's all year round, 3.5 years. Plus work full time. That's right. I was going to school full time and then working Monday through Friday on top of it. That's right. Not that I didn't work. Not I worked part-time. I worked 30, 34, I think it was, or 35 hours a week. Full time, 5 days a week, 3.5 years. Oh, and by the way, I was driving 2.5 hours, staying in people's houses that I didn't even know, staying there Friday night, Saturday night, driving all the way home Sunday night, and then going back to work Monday morning and doing it all over again, 3.5 years, okay? So this is a walk in the park. Just remember that, folks. When you think you're getting burned out, just remember, keep pushing. Keep pushing. That's what The Rock says, Dwayne Johnson, The Rock. Keep pushing, you just keep pushing. I got brains. I don't know, some people say I have rocks in my head for taking that kind of punishment. But, you know, when you love something and, you know, and you can really understand what it takes, sometimes it takes a lot. Some things had to be pushed aside for quite a while to be able to do that. Hello, Kim Young Rose, come on in. Welcome, welcome, welcome. Come on in. I just got done babbling about myself on a soapbox. So we're going to get back to, we're going to talk about surgery. Spinal surgery is the next thing right now. Come on in. Welcome, welcome, welcome. Come on in. Get connected. Leave a comments down below. Excuse me. Subscribe to the channel. Hit the bell. I will come and see you. You came to my live stream. I guarantee I'm subscribing to you. I guarantee I'm hitting the bell. I guarantee I will be coming to see your guys' stuff. It's that simple. I'm happy for you, Sir Joe. Well, thank you, Miss Jean's channel. Thank you so much. Hey, Pro Carrie. Welcome, everyone. Please remember to leave a thumbs up and share the stream if you can. Thank you so much. Thank you, Miss Cubs. Thank you so much for throwing that out there. All right, and so let's talk about spinal surgeries. I threw out a bunch of words earlier. Let me get something here to be a pointer. And let's go big. Let's go big on this one. So, we're coming in real close. Question, how do you treat slip disc? Oh, yes, you are in the right spot, girl. I'm going to be talking about that right now. Okay, so first things first. If you keep coming to my live streams as well as my next 4 videos are on spinal disc issues. You literally landed on this channel at the right time. My next 4 videos I'm doing that drop, each of them I'm dropping one each Sunday. I haven't made them yet, but my first one is on the anatomy of the disc. All right, technically there's no such thing as a slip disc or rotated disc. So my video on Sunday is going to educate you on that. The next video, the following Sunday, is going to be on treatment techniques that you can do at home for your disc problem. The third one is going to be on surgical techniques for disc issues. And then the last video is going to be about treatment techniques that the physical therapist is going to do in the clinic. So when you go to a therapist, what kind of treatments then you can expect to receive. So we talk about that disc, and you talk about that disc pushing out onto the nerve on the back side there. That's called when it's not hitting the nerve, it's called a bulge. When it starts to hit the nerve, it's called a herniation. When it starts to leak out along the channel area, we're talking about a leaky disc or squalidal, all right? Or you're talking about where it breaks off. You're talking about disc fragmentation, where a piece of the disc is broken off and it's actually floating inside the canal, and it's just banging that baby up. And you're probably getting scar tissue all over the place. More than likely, you'll have to have surgery for that, and that's what we're going to talk about right now. All right, from my neck down has a gap. I did a full x-ray. Oh, Pro Care Trucker, come on in. All right, unloading so I can't stick around. Ernie Hatmaker sent me, and I see Ed's attention to detail is here also. Thank you so much, Pro Care Trucker. I have also Brown Eye Trucker. She comes in. She's not here right now. We call her BET for short. Brown Eye Trucker. She's not here, but I shout out to her. She does all kinds of videos on trucking. If you haven't connected with her, you can go ahead and connect with her. If you could subscribe me, hit the bell. I will definitely come and see you. All right. Much love to you. Thank you for coming. I'm going to talk a little bit more about the surgery now of the disc. So I shared my community, your live stream, sir. Thank you so much, Miss Jean's channel. Much love to you. I appreciate it. Thank you for coming. I appreciate it totally. And I know it's tough because if your audience doesn't understand English, they might not stick around, and I understand that just because I don't speak another language. Though I'm trying to figure out how to make YouTube do the text, like the caption, so it goes from your language to, from my language to your language. And so that's the next thing I need to learn how to do better. I did it in the past for Spanish, but I need to learn, obviously, all kinds of Portuguese and all kinds of different languages that people speak that come to see my stuff. So I know I'm missing a huge chunk of people that might watch my stuff, but they don't understand the words that are coming out of my mouth. That's from the movie Rush Hour. You understand the words that are coming out of my mouth? Beautiful line. All right, so let's talk about the first kind of surgery that they will probably do. They'll call it as micro or minimally invasive surgery. And what they're going to do, this is the spinous processes. This is the bone that you see on skinny people. When you look at the back side of the spine, that's what you see on the tip there, is that spinous processes. Now, so that's orientating you a little bit. Oh, come on. I got that cord fighting with me on my laptop. Off to the side, you have these bones on either side is called the lamina. VA Scratcherly, nobody understands the words that are coming out of your mouth. Well, that's the reason why I got models. So hopefully, they're just words. And so if I show you what I mean, hopefully that will help a little bit. So this is called the spinous process. But anyways, so I nailed that before I have to go. Just got another subscriber also. Oh, that is awesome. Thank you so much. Hey, Joe, what do you know? Lionel's in the house. Come on in, Lionel. It's getting busy in here. We got 15 in the house. Come and get some connections. I got my boy Lionel from Canada. He does all kinds of stuff. You should go over and see him. He's great. He's loyal just like I am to a fault. He'll come and see your stuff. He does edited videos. He does live streams. Like I said, he's coming all the way from the good old Canadian border up there with the Huskies and everybody else. Hey, Joe, how are you? Beyond the Veil, come on in. Welcome, welcome, welcome. Come on in, Beyond the Veil. I'm talking about disc surgeries right now. Come and get some connections. Hopefully you see some people that you haven't connected with before. That'll be awesome. Hope you can come on in. So hot up here, brother. 40 Celsius, glorious past few days. It's been raining down here. But I'm in the dead zone, and I'm sweating to death because I got the lights on me. As you can see, my shiny head and my shiny cheeks. I'm sweating to death right now. I'm going to have to get something else to drink besides coffee, because coffee is caffeine, and caffeine is a diuretic, which means I'm losing more water than I'm retaining. Food for note. Oh, I got Beyond the Veil, says at VA Scratch Off. Hello, VA Scratch Off. You got some brother coming over here called the Beyond the Veil Investigations. They're awesome. It's a husband and wife team, I think. I watch their stuff as well as I watch the paranormal. I think it's all three paranormal or something like that. I watch them too. They're really cool. All right, Ren TV. Hello, Joe. Beyond TV, come on in. Welcome, welcome, welcome. Hit the subscribe button. Hopefully leave a comment. Dehydration, yes, dehydration. That's right. And that's what happens with the disc too over time, is it starts to dehydrate. Come on in, get some good connections. Hopefully shout me out. That would be wonderful. Hopefully you'll come back. I do my lives Wednesdays, Thursdays, and Fridays. If you see from my my channel art says that, as well as I drop my live edited shows. That's kind of redundant. No. I do my edited shows on Sundays. Pinching nerves all over. Next question: how safe is the surgery, and what will be long term? All right, so let's talk about the surgery. Kim Joe Rose. So this is the lamina on each side. What they do is they cut literally that bone out. All right, that bone. Absolute McGregor channel art, ha ha ha, reminds me of Gore. Yes, that's right. Some of my ideas I stole from Gore. But I figured it was decent, you know. I use Canva. as my thumbnails and my edited chart, my edited stuff, and so it comes out pretty decent. That's another 20, 30 bucks a month or something like that, though. You know, it's like, it starts to add up a while. Adobe After Effects, Adobe Premiere Pro. I mean, after a while, it costs some money to make a video. But, excuse me, a decent one. All right, so they take this bone out. It's called the laminectomy. Ectomy means taking away. Who is that Gore that you speak of? Oh, he has a channel called, it's called Gore McTar, M-A-H whatever. He does his channel. He's initially he started out as just like a vlogger, and then he went into more of like what Tuber Chat does, where they try to help you with the channel a little bit. But he's kind of veered off and done more live streams with some channel help, and then he's gone into some more like you know, how anxiety. He kind of moved around a little bit. I'm not sure if he's focused on his niche. What I initially thought was like helping people with their channels and stuff like that. You know, their thumbnails and their channel art and stuff like that. But he's kind of moved around a little bit, so I'm not sure if what he's doing with his channel when it comes to the niche. But that's him, anyways. Super Villain, aka Marvel or DC. I like both actually myself, so. But Superman's my greatest hero. And no, Batman can't beat Superman. Cubs Den says, at Beyond the Veil of Investigations. Hello, welcome, welcome. Look at that. We got another good connection. All right, got 25 thumbs up, 0 thumbs down. Woo! That is awesome. Thank you so much. And hopefully we will keep going with that. All right, so when I said ectomy means to take away. So literally the surgery is they take this bone away. Let's say the disc problem is on this side. They will go ahead and trim this disc away. So remember that nerve is right there. So they will take this bone away. So you see it from the side view, but if you see it from the back view, this is the lamina. They will cut that bone, that piece of the bone out, so that nerve has a lot of room to grow now. And then they'll go ahead and they'll take that disc that's pushed out on that nerve, and they will go ahead and trim that nerve back, that disc back, and free up that nerve. They might even take part of the facet joint. This right here, where my pen is actually the facet joint. And so they will go ahead and do a facetectomy, all right, and take that whole piece out. They might take just the lamina out in the disc. They might take the lamina and the facet joint and leave the disc and trim back the disc. And so that nerve has all this room now. It's not being pressed between the bone and the disc. That nerve isn't. So that's basically a laminectomy with a discectomy with a facetectomy. They will do and basically cut out that whole area. And so at that point, that frees up that nerve. If you have one problem, you know, the scar tissue was scarred down that disc, and lo and behold, you should be okay. As long as you do your physical therapy and you stop doing what caused the problem in the first place. The problem is we are natural creatures of habit, and if we don't have any pain, we're going to go right back to what we did before, and next thing you know, that disc pushes out even further this time, and they have to go ahead and do a spinal fusion because you can't do the lamina on the other side. The joint becomes unstable. So they have to go ahead and now fuse above and below that joint. Okay? They're going to take the disc out, discectomy at this point. All right? They're going to take that disc out. They're going to either graft bone tissue from your pelvis, or they might use a cadaver. They're going to then put those bone particles in that area, and they're going to bring them, this bone and this bone together with this disc gone. Imagine this disc gone out of there now. All right, they're going to bring these two bones together, they're going to put a rod on this side, a rod on the other side, and they're probably going to put a screw either on this angle down here or another angle up on this area to fuse the two bones together to make them one stable joint. So hopefully they go ahead and keep this area open. That's basically a spinal fusion, a posterior spinal fusion. Now an anterior spinal fusion, they're gonna come from the front of your body. They're gonna do the same thing. They might do and put a cage, literally a cage in this area and hold this together, as well as they might do some screws or a flexible rod on the back side. All right, and so they could do an anterior and posterior, or they'll just do a posterior fusion. And they might do multiple segments, multiple fusions along the spine. I want to say I'm back again. Thank you for Nicole for coming on back. I got 17 watching right now. Let me go ahead and refresh just to make sure I am on the right page with everybody else, because every once in a while that tends to go away. Back in the day, they used a Harrington rods. Yes, they used Harrington rods. You're going back a ways, brother, because Harrington rods were not flexible base rods. They don't really use, I mean, they might, I'm not a surgeon, they might use Harrington rods. They don't use them as much as they used to. Those were rods that did not move. At least the flexible rods they do now have a little bit of give to them. Now, there's a couple other types of disc things they used to do back in the late 90s and early 2000s. They did one of them they did, and maybe Lionel might know about this. It was called an IDET. I-D-E-T. It was called interdiscal electric therapy. And what they did is they actually, if you had a disc bulge or herniation, they went in with basically a wire that was electricity had conducted through it. They would inject it into that herniated disc area, and they would heat that area up. What that would do is that would cauterize the disc. The disc would recess back in off of the nerve, and it would scar down. The problem with that, it made perfect sense. Early signs of it was absolutely beautiful. It was so minimally invasive, it was ridiculous. I was seeing them back in the late 90s in aquatic therapy. And what it would do is the scar tissue would not hold, and it would go ahead and re-herniate. So that the carryover with it was poor. The long-term outcomes were not good with it. So they stopped doing it. Early signs of it was beautiful, but unfortunately the disc, the scar tissue in the area just could not hold that type of stress, and it would herniate back out again. 1979, that's what they wanted to do at me. When you were 13, Jesus, you weren't even done growing yet. Oh yeah, your what we call your epiphyseal plates, or also known as your growth plates, they weren't even done yet. Jeepers, you would have had all kinds of problems. Holy crap. I mean, at least wait till you've actually fully grown, and or put you in a brace. So maybe help reduce some of that shearing force. Jeepers, that's scary. So those are a couple different kinds of fusions that they can do. Like I say, the laminectomies. Now the newer ones that they're doing, one of the newer ones is called an X-stop type surgery. And literally what they do is they have this tool that almost looks like a pair of scissors. It starts out in this plane, and the hardware opens up like a pair of scissors. And so imagine you have really bad stenosis, which is stenosis so this is kind of a normal spine. So it's all nice and opened up. The nerve has got lots of room. Okay, and let's say over time the degenerative disc is kind of flattened out like it does on everybody, and then that canal starts to close down, and you're getting some wearing in that canal. So what they'll do, some of the newer techniques over the last, well, I don't know, probably 5, 6, 7 years. It's a fairly new technique. It's not that old. What they'll do is they'll take this thing, it's called an X-stop, and they'll go ahead and they'll put that in there, and they literally will open it up. And essentially, they put that in there, and they literally open that thing up. And that's what happens. And now you have hardware on this back side keeping the joint open up so it doesn't collapse anymore. So that's some newer ideas coming down the pike that you might, you know, they're always coming up with newer surgical techniques, less invasive stuff. And so if you can always, you know, go a conservative route, and then maybe down the road, whether it's stem cell research or disc reanimation through stem cells and stuff like that, all this newer, you know, on the fringe kind of medical stuff that's coming out that you guys don't know about because you don't read about it, you don't hear about it much. That's all the newer stuff coming out. And so that's the newer technique that's out there that helps with people with spinal stenosis. And so that's one for the books. If everything else is stable, you know, unlike Lionel, he's talking about where he's got this translation forwards, he's got the Scotty Dog stuff, all this stuff that I'm throwing out at you that he knows about. He's got like a grade 2 or grade 3 anterior translation of the one spinal joint on the other. He's got this going on, which is not good. One spinal vertebral body gliding on the other one, which is called spinalothesis. It's hard enough to spell, let alone say. I just say shifting forwards, but that's what it's called. A spreader, if you will. Yeah. I mean, it really comes from that idea, you know, and the hardware that it's makes perfect sense. If you can get that nerve to calm down by stopping something compressing on it, and you can make that joint not only stable, but also keep it open again. I've treated a few people over the years on it, probably like 6 or 7 years ago in New York State when I still worked up there. And they did well with it right after surgery. I did, you know, in outpatient wise too, so. Yeah, you're missing an L there. Spondylolisthesis. You're close. You're close. But yes, that's what it is. All right, I gotta go get myself a drink. I've been up here for over an hour, and I need to get something more than just coffee. I'll be right back.
I'm back.
Got me some water. Nice job, Lionel.
All right, why isn't this not working? There we go.
All right. Frugal Farms, hello everyone. Come on in, Frugal Farms. Welcome, 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 welcome. Come on in. Let's get some connections in here. Come on in. Let's go, let's go. Or as they say, let's go, let's grow. We're talking about surgeries here. So I talked about the X-stop, we talked about the laminectomies, we talked about the discectomies. We talked about the anterior spinal fusions with the cage. We talked about the posterior spinal fusions with the rods. I started jungling white tap dancing to keep everyone entertained, but they couldn't see me. Well, thank you for trying, Lionel. It's always a pleasure to have someone else try and keep people entertained besides myself. And you know, Scully's not saying anything right now. So you know about him. All right, I got 12, 13 watching. Got 31 thumbs up. Nice. Okay. So let's take a step. Talk about the neck here for a second. This purple thing. We're talking about your purple neck here. This thing is the base of the skull. And we have, what'd you say? Scully is a coward. He doesn't have the guts to fight anyone. Just think, everyone, it's 40 Celsius. I was doing that naked. Oh, God. Oh, God. Oh, no, don't say that, Lionel. Oh, oh I know. All right. And so we have the 7 bones that make up the cervical spine. The classic one that ends up having disc problems is down here at C6, C7. And that's where most of your movement comes from. 50% of that movement is coming from that segment. Full disclosure. Sorry for the pun. Yeah, right? Nice, Lionel. So 50% of all your movement looking down and looking up, looking down and looking up occurs in that one segment. So a lot of times if you have a neck or you're having symptoms down in your arm, more than likely it's coming from that one segment. This is so small up here. The discs are very small. The bone themselves are very small. And it doesn't really take much disc issue to cause symptoms down in your arm because everything is so much smaller, so much more compact versus your lower spine. The bones are bigger, the discs are bigger, the space is bigger. Up in here it's very small, and so it doesn't take much to cause nerve symptoms down in your arm when you have a disc issue, or just the nerve is inflamed from maybe the joint arthritis. So what they will do a lot of times in the neck, they won't tend to do laminectomies and stuff like that in the neck, just because thank you, Miss Cubs, for still being here. You know, if they try and do in the neck what they do in the lower back, your neck is can be very unstable very quickly, and so they'll tend to just naturally just do fusions to the neck that they would not do to the back. They would do a laminectomy or take the disc out or do all kinds of things because everything's much larger down here. Everything's much more stable down here that it can take those types of surgeries that you can't do in the neck. The neck just can't take it. You lose too much stability in the neck too quickly because things are too small and the bones are too small and the discs are too small. There's a lot of vital stuff in this area. There's not like there's nothing down below, but like I said, those are the main reasons. And a big boogie to boo to you, Cubs dad. Oh, you guys are silly. Okay, so they will go ahead and literally just scrape those discs out and start fusing them. One on each side. And a lot of times they'll fuse two. They usually don't fuse one anymore. A lot of times they'll fuse two. The reality is usually you're having degenerative disc that's pretty unstable, and you have a really bad disc. And if they just do a fusion on one site, and you have a bad disc above and below in the neck, you automatically, if you fuse one site, you make that spinal area above. So let's say you had a fusion here, they took that disc out. Now below and above has to take a lot more stress. And so, well, that's nice, Nicole. We're going to keep things non-political here, Paul. Why is that going on there? I almost have to reset my YouTube. Let me go ahead and... Don't want to do that. New problems, brother Joe. My giggly pen has been disconnected from my laughing shaft. Any remedies? Alcohol? For medicinal purposes only. So when they fuse one of these segments in your neck, naturally and if you have hi Miss Jean's channel, much love to you, they will go ahead and fuse above and below that site, because a lot of times they fuse one segment and the upper disc is weak and it's just going to collapse. When they fuse that site below, they'll end up fusing a couple sites. A lot of times if it's C6, C7 here, the last vertebrae before you go into your mid-back area, they'll fuse those two segments, because once you get to the thoracic or mid-back, we have the ribs there. That, ladies and gentlemen, was Joe Confused. Lots of laughs. Love you, brother. Ha, 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 ha. Oh, man. I don't know about you, Lionel. You are something else, sir. So that's what they'll do. Everything is so small in this area. Thank you, Miss Jean's channel. Much love. Thank you for staying and listening. I appreciate it. I got 11 in the house right now. Hopefully we can get some more. So that's the basics of fusion. Now, when you come for physical therapy, we have protocols that we have to go by depending on what the physician allows us to do. Sometimes they'll just say, no lifting, no twisting, no pushing and pulling for so many weeks, and we can basically do anything besides that, which we wouldn't do that anyways if you just had spinal fusion. But we're gonna, we'll look at range of motion above and below the segment. We'll look at flexibility, look at strength, seeing if there's any type of functional limitations. You're not walking right, you're having difficulties with standing and sitting or sleeping, all those other things that we take for granted. Miss Galaxy's giving me some smiles. Hi, oh, Lionel says, hi, Jean's channel. Lionel's coming over to Jean's channel. Better watch out. You're going to get a new connection there, Miss Jean. I think you're getting someone, Miss Jean. I think Lionel's coming over to you right now. Right now. I like that. I love doing that. Right now. It's almost like a radio disc jockey voice. This is. Obviously, if you've seen any of my edited videos, I do that a lot. Okay, once we talked about the neck, we talked about the low back. Once we get to that mid back, we got our ribs. We got our ribs coming around on both sides, obviously our ribs. And they really stabilize that mid back. Those 12 bones that make up your mid back really get stabilized by the ribs. So rarely do you hear any disc problems unless you get car accident, some sort of major trauma to this area. And they tend to do very well post-operatively anyways, just because the ribs, everything's very stable in here. They're not as large as the low back, but they're much larger. The bones are much larger in the mid back than they are in the neck. Well, Nicole, if you're getting hungry, I understand that you need to go. I want to say thank you for coming by, Miss Nicole. So when we talk about this mid-back area, if someone's had a disc, I think Kevin Hart, I think he had a fusion or something in his mid-back area from that last car accident, and you can see how well he rebounded. Obviously, he had the state-of-the-art stuff. You know, the guy's a multimillionaire. Everything that's medically possible, stem cell research, spinal fusions. He probably had, the gift of God physician that was touching him. He probably had the best in the nation that does spinal surgeries on him. And so you can see how well he's doing. But a lot of that is because where the actual injury occurred at. When you get injured in this mid-back area, your recovery is much quicker than it usually is in the neck or the lower back because of those ribs and the size of the vertebrae in the disc within this mid-back area. I'm hungry too, thinking about having a peanut butter and sardine sandwich. Oh my God, that sounds terrible. Leah Mix Vlog in the USA. Miss Leah Mix, come on in. Welcome, welcome, welcome. We're talking about the disc. We're talking about all kinds of surgeries that you have with the disc. We're talking about what the heck is the disc. We're getting some good connections in here. Hopefully you meet some new people in here. Leave some good comments. Hopefully get some good viewership, some good connections with some people in here. Okay, host. Obviously toasted on rye. I'm not an animal. Oh, okay, yuck. Peanut butter and sardine. Anything with sardines to me is yuck. Peanut butter and sardine sounds yummy. Well, yeah, Ed, I'm sure you probably think it's yummy. I would, you guys are, you're just ruffians. You're just ruffians. I'm going to stick to high quality H2O. Okay, so that is basically the gist of the mid-back. A lot of times you get an MRI and it might show a disc bulge in the back, but be very mindful that it's probably asymptomatic, which means A in front of a Latin word means the lack of or no. And so in this case, your symptoms, even though you have a disc problem maybe in your mid-back, it's not what's giving you your symptoms. It's probably coming from your neck, or depending on how lower we're talking about of the because the 12 vertebrae, that's pretty long. The thoracic area is the longest. You have 7 neck, 5 lumbar. You have 12 thoracic. So if you're down lower towards the T12, T11 area, and it probably is coming from L1, L2, and if you're up at like T1, T2 area, T3, and having symptoms, it's probably coming from C6, C7, or C8 nerve. So be mindful of that. That a lot of times it could be probably neck or back. Your symptoms aren't coming from your thoracic area. If they fuse the neck bones, does it affect your range of motion? Yes, Mom. Thank you so much for keeping the dialogue going. Because my mom realizes I'm running out of steam. Yes, if they fuse any, I've had quite a few patients lately. They get those fusions. The physician doesn't tell them, hey, look it, I just fused most of your neck, or I just fused most of your lower back. You're gonna have for some reason the patient comes to me and they're completely oblivious that the fact that they're not gonna have the same motion that they had before. I don't know why. There's a huge disconnect. Maybe the doctor told them and they forgot or didn't pay attention. I don't know. But all I can tell you is yes. Because C1, C2 of your neck up at the top is where 50% of your rotation occurs at that one segment. The other 50% of your motion for looking over your shoulder occurs through the rest of the vertebrae in your neck. Looking down and looking up, 50% of that entire motion occurs at 5 and 6. Or 6 and 7, 6 and 7. All right, and the other 50% makes up that. So if you're fused at C6, C7, and you're fused at any of the other ones, yeah, you're not gonna get 100. You're lacking already 50% of your motion looking up and looking down. You're not gonna get. People think, why can't I look up again? Because 50% of your motion that used to occur, they fused it. You're only gonna get at best 50% or half of your motion back because they fused just that one segment. If they start fusing multiple segments in this area, you're going to lose even more, which is what they usually do. So the reality is it's not muscle tightness. They fixated the joint, and you're trying to get more motion. The reality, it's not going to happen. It's not going to happen ever again. And so, unfortunately, I become the evil therapist because I'm giving them bad news that the surgeon should have done. The surgeon makes 1,000 times more money than I do, and at least they could do is have their peon physician assistant tell them, yes, you're going to get half your motion back because we did this. That doesn't happen though. They pass the buck on to the therapist. So I always tell them, go back to your physician, be mad at them. The reality is when they go back, they never tell them. So yes, same thing in the lumbar spine. If you get fused at L5S1, that's the last disc before we get into the solid bone of the sacrum. If they fuse L5S1, 50% of your movement occurs this way and this way at that one segment. If they fuse that segment, you're not going to get 100% back. You're going to get at best 50% back unless you start compensating. Either you start getting more movement in this area or you start stressing that hardware, which is not a smart thing to do. So be mindful. And if they fuse multiple segments in your spine, in your lower spine, you're going to be missing more. You're like, why can I not bend forward like I used to? Because they fused your spine. And the doctor's not saying, hey, look we're going to reduce your pain, or we're going to at least improve your leg strength, or nerve pain's going to be less. But the trade-off is you're going to lose a lot of motion. We're creating stability where you did not have any before. So where you have more stability, you're going to have less mobility. That's the key, folks. You get one or the other. You can't have both. If you do have both, you're probably either on the Olympic team, or you're some sort of anomaly of the human species. With my glowing black eyes, though. My Uncle Ronnie had a Harrington rods from C1 to S1. Won't be seeing Mr. Happy in the shower no more. C1? I never hear them fusing C1. So essentially, you're telling me they literally infuse his entire spine. So he must have had really bad scoliosis. He must have had a lot of rotation and twisting, and it was affecting his breathing. At least I hope it was, because to fuse the entire spine, I don't know. I mean, I'm not an orthopedic surgeon, but I mean that's wow. That's not good. That's pretty bad. Train accident. He had his whole spine done. Oh, okay, that makes sense. That makes sense. See, he had a trauma, and the best thing they could do to put Humpty Dumpty back together again was do this, you know. So, did he walk again? If he was young enough, he probably did walk again, unless he had permanent nerve damage. So yeah, he didn't have enough motor loss that, he walked again. Okay, good. Got 14 in the house right now. We're trucking along. We are at 2 hours. We got these many people in the house. I'm going to keep pushing along. Megman Vlogs in the house. Average Joe Evil Therapist at age. Average Joe Evil Therapist. No, evil. I you have to have the darkness to know what the light is, brother. Ever see that movie with Eddie Murphy, who I think he's a vampire, and he goes to the church and he talks to the congregation. He's up on the pulpit and he's trying to convince the congregation that evil's good. It's very funny. It's probably the funniest part about that. And he talks about, you need evil to know what good is. And if evil is good, when you to know what good is, then good is evil and evil is good, and it was hilarious. He was really trying to intertwine it. It was obviously he's Eddie Murphy. He's amazing. I can't do him no justice. So, anyways, it's very funny. Oh, shout out to the host. Hi everyone here, Megman. Go ahead and get some connections. Connect. I was talking about the disc today, the last 2 hours, which is quite impressive. I talked about all the different types of herniations, some basic surgeries. Talked about the neck, the mid back, and the low back. Talked about showing you exactly what the bulge is, or herniation, or rupture, or fragmentation. Oh, Lionel, there's a lot of truth there. You know why? Because it's just being human. And humans love to make up stories and allegories, don't they? All you gotta now, the internet is classically made it obvious on if you look at the whole world view on certain things, it really starts to open the eyes in different cultures and different themes of different concepts and ideas. So it's really cool to see how people perceive different things. Does anybody have any questions? I mean, I think I answered a few earlier. I gotta click out and restart this. For some reason it was giving me a problem here. There we go. There we go. I got 13 in the house. Thank you so much. Let's see if I can answer anybody's questions. If they fuse the neck bones, does it affect... Okay, that was my mom. I talked about that. All right, here we go. No, I don't see. If you guys have any questions, I don't see it right now. Don't forget, look up and keep smiling. You forgot last night. Oh, I did. I did forget last night. You're right, Mom. Question now. Excuse me. Question: how many have tried making dirty pictures with an Etch-a-Sketch? Just curious. Excuse me. Lionel, this is not that kind of live stream. I don't know about you, Lionel. Most of these young people don't even know what an Etch-a-Sketch is. If you're not probably at least my age, maybe in your 30s, maybe if you're 10, maybe early 30s, you might know what an Etch-a-Sketch is, but other than that, probably don't know. All right, folks, I'm going to finish that here. Tomorrow I want to say thank you all. Tomorrow I'm going to be like 2 o'clock, somewhere around in there for my live stream. Hopefully you can come out and see me then. I'm going to talk tomorrow about different treatment techniques that you can do in the home, as well as kind of review what we've talked about the last 2 days in regards to disc problems in your back. And so, Scully and I want to always tell you guys, we want you to look up and keep smiling. See you next time, folks. 2 o'clock tomorrow. Bye for now.